Hi, everyone, and welcome to this webinar. By the end of this session, you will be able to explain the procedures that the technical delegate or a medical delegate need to follow in case of doping control testing. First of all, at the planning period, the technical delegate and the medical delegate, if you have any at your events, must receive adequate information in the planning process of the event for the in-competition anti-doping control to be conducted. Such information should include the name of the sample collection authority, the number of urine tests and type of analysis, and blood tests, if you have any at your events, and the destination laboratory of the tests. This information should be handled as sensitive and should not be shared with the general public, and they should be communicated to World Triathlon through the pre-event report. The technical delegate also should ensure that the below facilities and procedures are in place for the event. Regarding the doping control station, they should be located near the competition or the training site. The location should be private and secured and should be clearly marked with signs. This station should also be divided into 3 separated but interconnected areas, including the waiting area, the doping control processing room, and a washroom. Regarding the equipment that we should have at the doping control station, first of all, the LOC is responsible for providing sealed bottled water for the athletes who will be tested. Any other beverages provided to the athletes should be non-alcoholic and non-caffeinated, and they should be approved by the doping control officer. There is a minimum number of 3 bottles of water per athlete that is being tested to be provided. You should also have chairs, tables, and stationery for the athletes to sit and for the doping control officers to be able to write on and use during the paperwork that is needed to take place. Regarding the selection criteria, and that is a big subject that is troubling most of the technical delegates. The selection criteria is being set by World Triathlon and the International Testing Authority during the event week. They are being communicated directly to the Sample Collection Authority through the mission order number that is being created and issued on Adams for all the events in the World Triathlon calendar. Now, there might be a case that these selection criteria cannot be met on site, or the information didn't come through and the mission order was not created. On these rare occasions, the technical delegate may be called upon to help with the random drawing of the selection of the athletes. The technical delegate should also be prepared for anti-doping control personnel to show up at the athletes briefing. And in this case, they should help the doping control officers to find the selected athletes and make sure that any testing is done so that the athletes can attend the full briefing. In terms of the paperwork around the anti-doping, nowadays more and more sample collection authorities are having a paperless process of anti-doping control. However, if still paperwork needs to be used, these doping control forms should be sent to the World Triathlon headquarters, and that should be reported at the post-race report. Also, the TD should report any unusual occurrences regarding anti-doping to World Triathlon. Here you can see a table that summarizes the roles and responsibilities of the technical delegate and the medical delegate before on site and after an event regarding anti-doping. So before, you should ensure that the anti-doping plan is in place and familiarize yourself with the plan and procedures. During the event and on site, you should check the anti-doping control facilities. You should verify that the personnel is on site before the start of the race, including the doping control officers and the chaperones. Ensure that the athlete's rights and obligations are met for anti-doping control. And particularly for the medical delegate, they are responsible to authorize or deny the anti-doping testing, assessing the athlete's medical condition. They can also issue a therapeutic use exemption form if needed. And either the technical delegate or the medical delegate should liaise together with the local organizing committee and any World Triathlon staff if they are in place, if any issues occur. After the event, the medical delegate should send any TUE forms if used to World Triathlon, report any issues to World Triathlon, and any doping control forms should again be sent to World Triathlon if they were used. Here you can find some useful links regarding some documents related to anti-doping. So on the World Triathlon website, on the documents section, there is an anti-doping section in particular with some useful documents. Especially if you're a medical delegate, you should familiarize yourself with the prohibited list that is being updated annually. You should have with you the therapeutic use exemption forms if needed to be used on the race. And there is also the medical and anti-doping management at 3 events document that again contains information regarding the roles and responsibilities and procedures. Thank you so much for watching, and I hope you found this webinar useful.